Hello. In the previous video, we went through 10 alarming signals of selenium deficiency, from brain fog to thyroid problems. We already know that selenium is a trace element with jewelry-level precision in dosing, one step to the right, one step to the left, and benefit turns into poison. If you missed the first part, be sure to watch it later. But what should you do if you have found these signs in yourself? Running to the pharmacy and buying the first bottle you see is a bad strategy that can end in liver toxicity. Today, we are moving to practice. This is information for those who want to restore their selenium level properly. I will explain why the standard blood test for selenium is often useless, which 3 indicators will actually reveal the truth about your deficiencies, and we will find out why Brazil nuts can be dangerous with high homocysteine. Let's begin. How to determine your selenium level. And now attention, the most important part. Most people go to the laboratory and take a serum selenium test. The result comes back within normal range, and you calm down. This is a trap. Why is serum called the gold standard? Simply because it is the cheapest and most technically accessible test. But for you and me, it is often useless. Blood serum shows what you have eaten over the past couple of days, and mainly reflects selenium transport, not its concentration in tissues such as the thyroid gland. That is, even a normal serum level does not exclude the possibility of selenium deficiency in the thyroid gland. What should you actually test? To assess the actual availability of selenium for tissues, especially the thyroid gland, more effective markers are selenium level in whole blood. Unlike serum, this test looks inside the cells. It will show long-term status over 3-4 months. Selenoprotein P. This is a predictive marker. Selenoprotein P is the main transport protein. If deficiency begins in the body, the level of this protein drops first, even before the main test shows a problem. And vice versa. When we treat a deficiency, the body first restores the level of this protein, and only then, selenium itself. This is the ideal test for monitoring treatment. Glutathione peroxidase, GPX activity. This is a functional test. It answers the question, is your selenium actually working, or is it just on the payroll? Glutathione peroxidase is a protective enzyme that works only on selenium batteries. If the activity is low, there is no protection, no matter how much selenium is floating in your blood. Selenium in urine. Everything is simple here. We use this test only to diagnose intoxication. If you have overeaten those Brazil nuts, urine will show the excess. Hair mineral analysis. Hair accumulates minerals for weeks and months. But be careful. If you use medicated anti-dandruff shampoos, many of them contain selenium sulfide. The test will be falsely positive. Can you just start taking selenium without a blood test? And now the most frequent question I hear in my office. Doctor, can I just start taking selenium just in case? It's just a vitamin. My answer as a doctor is unequivocal. Selenium is not something to joke about. As I already said, selenium is a trace element with a narrow therapeutic window. Imagine a narrow bridge over an abyss. One step to the right, deficiency and disease. One step to the left, toxicity and poisoning. The line between salvation and harm here is thinner than with most other trace elements. If you're taking supplements with a hidden excess, your body will respond immediately. An overdose can be toxic. Signs of excess are as follows: metallic taste in the mouth, brittle hair, nausea, a characteristic garlic odor of the skin, and liver damage. Therefore, I recommend taking a test first, and only then starting supplements. The myth of safe nutrition. And here many of you probably thought, okay, doctor, I will not buy pills. I will just eat foods rich in selenium. You cannot overdose from food, right? I have to disappoint you. With selenium, this trick that works with most vitamins does not work. Selenium consumed from food can also cause a toxic effect. However, if you are careful, food remains the most natural way to maintain selenium levels. Which foods contain the most selenium? Brazil nuts, the leader, seafood, eggs, liver, fish. Look at the first line. The Brazil nut is the absolute record holder, but it is precisely the one you can realistically poison yourself with in one sitting. However, there is a nuance. The selenium content in a nut depends on the soil where it grew. One nut may contain 10 micrograms and another 100 micrograms. The daily requirement for an adult is about 55 to 70 micrograms. However, I have come across information that Brazil nuts coming from Bolivia and Peru, whose soils are much poorer in selenium than in Brazil, contain less selenium, approximately 9 micrograms. There are places on the planet, for example, some provinces of China or states in the USA. Here, the soil is so oversaturated with selenium that local residents suffer from chronic selenosis. They experience massive hair loss and nail destruction. In Europe, the opposite problem exists: total deficiency. But if you buy exotic products from selenium zones, the risk is there. There is a cumulative effect of selenium. Our body perceives it as a regular amino acid and incorporates it into the proteins of muscles and organs. If you overeat high selenium foods every day, it is not excreted immediately, but accumulates in tissues. And when the depot overflows, problems begin. My advice as a doctor: treat Brazil nuts not as food, but as a dietary supplement. No more than 1 to 2 pieces per day, depending on your selenium level. But there is another nuance that even many nutritionists do not know. Why do I, as a doctor, advise caution with Brazil nuts if you have vascular problems? The fact is that this nut is a champion not only in selenium, but also in the amino acid methionine. Normally, we need methionine, but in the process of metabolism, it turns into homocysteine, a substance that harms blood vessels more than cholesterol. Therefore, if you have elevated homocysteine, you need to be careful with Brazil nuts. My advice: if you replenish selenium with nuts, make sure your diet contains enough greens, legumes, or high-quality B group supplements. This will balance the biochemical scales. By the way, I spoke in detail in one of the videos about why high homocysteine is more dangerous than cholesterol, and how to lower it. The link to it will appear at the end of the video and in the description. Be sure to watch it after this video. If you do not like exotic foods, your choice is seafood and eggs. Selenium from them is absorbed by 80–90% thanks to its combination with protein. But it is important. If you have chosen tuna as the ideal source of selenium, there is a medical catch hidden here. Tuna is a long-living marine predator. Over its lifetime, it manages to accumulate in its muscles not only beneficial selenium, but also heavy metals, primarily mercury. Mercury and selenium in the body are sworn enemies. Selenium's unique ability to bind mercury and remove it. But there is bad news. If selenium is busy fighting mercury from the same tuna, it does not go to serve your thyroid gland. You ate it, but it went to detox, not to benefit. My medical life hack: choose fish according to the principle, the smaller the size, the safer it is. For vegetarians, garlic is suitable. It has a unique ability to pull selenium even from poor soil. But remember, if the soil in your region is depleted, as in most areas of the Middle Belt, then garlic will also contain many times less selenium. But let us be realistic. We do not live in a perfect world, and we do not always have access to fresh seafood or trusted nuts. There are situations when deficiency is already confirmed by tests, and diet alone cannot correct it. This is where supplements come onto the stage. But how do you choose the one bottle that will actually work and not just pass through in transit? Let us figure out forms and dosages. How much selenium is needed? Average requirement, 55 to 100 micrograms per day. For therapeutic purposes, 100 to 200 micrograms is sometimes prescribed, but only under medical supervision. Never take dosages above 200 micrograms without a doctor's prescription. Choose the correct forms, selenomethionine or selenium-enriched yeast. They are absorbed better than inorganic sodium selenite. But it is not enough just to swallow a pill, it has to reach its target. Now let us examine which factors influence the absorption of selenium supplements. Vitamin E. This is a classic biochemical duet. Vitamin E helps selenium not only to be absorbed but also to accumulate in the liver, our main depot. If you have fat deficiency in your diet and lack vitamin E, selenium will pass through in transit. Iron. I often have patients with anemia who take selenium but see no effect. Why? Without sufficient iron levels, the main protective enzyme, glutathione peroxidase, simply does not turn on. First, we treat anemia, then we expect miracles from selenium. Protein and vegetarianism. If you're a vegetarian and consume little protein, your body simply has nothing to build the very proteins that transport selenium. The mineral level will drop simply because of an empty construction site. Intestinal bacteria. This is perhaps the most interesting part. The health of the thyroid gland and the intestine are inseparably connected. Your friends, lactobacilli and bifidobacteria, help selenium to be absorbed. In autoimmune diseases, their numbers decrease and absorption drops. Your enemies, bacteria such as Escherichia coli, Streptococci, and Clostridia, behave like real pirates. They steal selenium from your body, use it for their own needs, or turn it into an insoluble form that your intestine simply cannot absorb. Well, now you know more about selenium than 90% of outpatient clinic visitors. We have gone from Marco Polo's poison to the main defender of your immunity. Thank you for your attention. Write in the comments, did you know that Brazil nuts can be dangerous? And see you in the next video.